Thank you very much, Presiding Officer. I've bypassed my domestic broadband failure by being out in my car and using my phone to connect you. So that will work, I know perfectly well. But more fundamentally, I sit looking out over the very last of the sun, over the Moray Firth to the Highlands, and the area from which my father came as he was born and brought up in the Bill. My main hobby these days is genealogy, and so therefore I look at many of the certificates, particularly death certificates of my ancestors and the ancestors of other friends. And what is quite remarkable when you look at the cause of death of many people in the Highlands into quite modern times, it will simply say general debility, no medical attendant. In other words, there were no medical people to tend to people at the end of their life, and I know perfectly well at other points in their life. So the Highlands and Islands Medical Service was a quite remarkable and visionary attempt to right the wrongs of access to proper healthcare that had been wholly absent from people right across rural areas of Scotland. One of the early appointments was to send a community nurse to Hurta, to St Kilda, just in time for the First World War to break out. So the world in which my father was born into in 1904 in the Highlands was a fundamentally different environment from that which we have today. And indeed, every decade has seen the health service and health provision in Highland areas and across Scotland and beyond change. My very first dentist, for example, had no medical qualifications whatsoever, and so couldn't prescribe and couldn't give anesthesia when he was working on teeth in your mouth. So the Highlands and Islands Medical Service was a really remarkable visionary step that came from the Liberal government that there was at that time, that introduced the national insurance system that provided people with a pension for the first time. Parahandy, in one of his imaginary tales written over 100 years ago, talks about pension farming. And he also talks about medical provision in the Highlands and Islands in the coastal trade that he and the crew sailed around our coasts. So David Stewart, I particularly congratulate for bringing this to Parliament. He, like myself, is coming to the end of his parliamentary career, as others are, Presiding Officer. So this will probably be the last debate that he leads, and I think if that is so, there is no finer way for a parliamentarian of some considerable distinction, albeit I have not agreed with him on every possible subject, to go out on a high in bringing this important topic to Parliament. Today we have a health service that's modelled on that experience. Without it, we would probably not have had what we now take for granted in the NHS in Scotland today. Thank you, Presiding Officer.